Boy, look at it is 1 o'clock right on the dot, and we are getting started. So hopefully, we're gonna on the back end we'll be on the good side as well. It's good to see all of you. Let me call this February 18, 2026 meeting of the Commission to Address Homelessness to order, and I will ask Commissioner Pitts if he will lead us in the Pledge of Allegiance.
Let us recite the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Pitts.
Thank you.
We'll go ahead and just start us off by making a few comments. The agenda for today contains a brief general description of each item to be considered. Except as provided by law, no action shall be taken on any item not appearing on the agenda. The Commission to Address Homelessness encourages public participation. If you wish to speak on any item appearing on the agenda or during general comments, please complete a speaker request form and turn it into the clerk prior to reading on the item. The speaker will be given up to 3 minutes to speak. The clerk will run the timer and announce when your time is up. Public comment may also be submitted electronically by emailing response@ocgov.com. That hasn't changed with our new domain site.
It is, but it'll still work for the next year, so we haven't updated the script yet.
Got it, just check. With that, with that, we will move on to roll call. Madam Clerk, if you'll please call the roll.
Thank you. Commissioners, please indicate your presence when I call your name. Commissioner Sarmiento.
Here.
Commissioner Wynn. Commissioner Vasquez. Commissioner Rose.
Here.
Commissioner Parks.
Here.
Commissioner Hawley. Commissioner Shinagawa.
Here.
Commissioner Hurst.
Here.
Commissioner Pitts.
Here.
Commissioner Cunningham.
Here.
Commissioner Asuncion.
Here.
Commissioner Spitzer.
Here.
Commissioner Helly. Here. Commissioner Mockville. Commissioner Bruno Nelson.
Here.
Commissioner Riojas.
Here.
Commissioner Morse.
Here.
And Commissioner Taylor.
Here.
Thank you, and confirm we have a quorum.
I should have asked, how does this room feel to you all? I know that we just moved across the street. The commute's much shorter for me, by the way, just come downstairs. But how do y'all feel? This is kind of a little bit more warm, more intimate, right?
I think so, yeah.
I mean, literally warmer, because
Yeah.
it's kind of cold in the other room. I would see people in coats and blankets and all bundled up.
That's why we dress like this.
But anyways, so hopefully this is going to be our new home that we're settling. So hopefully it's a little bit more intimate and personal. So good to know. As a reminder, please be aware that the room is hot mic'd for the live streaming of the meeting. Additional microphones are placed on the table in front of you. Commissioners, please speak into the microphone so it may pick up your comment for the live stream. Please try to keep side conversations to a minimum, as they may be picked up by the microphones throughout the room. At this time, we'll take public comments from any members of the public wishing to speak or address us on any non-agenda topics that are under the subject matter jurisdiction of the Commission. Madam Clerk, do we have any members of the public that would wish to address us?
We have no request to speak under general public comments.
Great, thank you. So with that, we'll move into Commissioner comments for today. I want to take a special moment to thank and welcome Commissioner Virgil Asuncion as he was able to meet with us in the meeting in December. Welcome, Commissioner. Thank you for being here. And I'll open it up to the Commission if there's any commissioners that would have any comments. Commissioner, please, Morse.
Well, seeing as how this is our first meeting of the year, I would like to suggest that we make it the best year ever.
I think that's a motion.
I'll second that.
There you go. I don't know if there's any dissent on that one, but yeah, I agree. Thank you for that. I hope that we hit the ground running. It's already mid-February, so it looks like even though it's our first meeting, it seems like we're well into this year. So we don't want to take it by us, but I agree. Any other members of the Commission who wish to make any comments? Seeing none, let's move into our discussion items on our agenda. Madam Clerk, if you'll please read the first item.
Item 1 is the Commission to Address Homelessness update, which includes updates on membership and the Continuum Care Program Notice of Funding Opportunity. And we have no request from the public to speak on this item.
Thank you. I'll go ahead and turn it over to Doug.
Yes, good afternoon, everyone. Welcome to our February commission meeting. I'll start with a few commission updates. Okay. So the first update that we wanted to provide was a membership update. So at the meeting at the February 10th, 2026 Orange County Board of Supervisors meeting, the board approved the board, committee, and commission appointments. And for us, I'd say luckily we were assigned Supervisor Sarmiento and Supervisor Nguyen for a second straight year. So we wanted to make sure we welcome them back to the meeting and point that out. And then additionally, the other membership update is on February 3rd, the city of Anaheim announced the resignation of city manager James Vanderpool, who was our North Spa representative here at the commission for at least 5 years, and really appreciated his participation here at the commission. And we'll talk a little bit later in the agenda about filling that seat moving forward. The other update we want to provide is around the COC program NOFO. So as many of you know, we've provided updates on the COC NOFO and the progress that is happening over in Washington around this particular funding and the application for it. After receiving an update on the COC NOFO at our December 11th meeting, you all as a commission voted and directed our office, the Office of Care Coordination, to draft a position letter to support a 1-year renewal of existing COC program grants expiring in this calendar year for transmission up to the Board of Supervisors. Many of the commissioners who were willing and able to sign on to the letter in their capacity provided signatures for the attachment. The letter was discussed at our Board of Supervisors meeting on December 16th, and although an action wasn't taken, several supervisors, including Chairman Sarmiento, stated support and intention to send letters up to our federal delegation in support of this.
Are you going on to the next topic?
Not yet. To the next slide, if that's okay. In regards to the status of the actual funding, I wanted to share some key updates as well, because there has been significant movement over the last 2 months. So right after our meeting in December, on our December 11th meeting, on December 23rd, federal court issued a written preliminary injunction that affected HUD's COC funding process. HUD was required to take steps to process eligible renewal projects for 2025 using the 24-25 rules. However, the court made it clear that the order did not require HUD to award or obligate funds, just to run the NOFO. On January 9th, HUD reopened the FY 24-25 Notice of Funding Availabilities and provided 1 month for continuance of care to submit their application. On January 21st, the Board of the Orange County COC Board approved the ranking and tiering strategy and priority listing, which is a very important and particular step to help us in order to apply for those funds by February 9th. And then on February 3rd, as many of you know, the Consolidated Appropriations Act of 2026 was signed into law, which funds the majority of the federal government through the end of September, and it included provisions to expedite the renewal of FY 2025 COC funding and provided some protections for the next year, FY 2026's COC program competition. And we'll provide some of the key details in the next slide. And then lastly, on February 6th, our office, in coordination with the COC and the COC grantees was able to submit our final FY 2025 application up to HUD for these particular funds. So worth noting is this the Consolidation Appropriations Act of 2026. So there's really sort of two things happening at once, or two things impacting this funding. One is this Appropriations Act, and the other is the federal court case that is still pending. When it comes to the Consolidation Appropriations Act, it's important to note that that act requires that HUD immediately renew non-competitively all projects expiring in the first quarter of this year. So that essentially means, as many of you may remember, out of the 22 or 23 grants that HUD provides here for the in Orange County, 2 of those grants expire, either have expired or will expire during the first quarter. All of these grants expire at different times during the year. So as we talked about before, this is where it gets slightly complicated. What this Consolidated Appropriations Act has required is that HUD, as I mentioned before, renew all projects that expired in the first quarter. Although this has been passed, we've yet to hear directly from HUD how they are going to do that. Additionally, the Appropriations Act states that if HUD does not make an award by April, HUD must renew all of the awards that expire in the second quarter. And then they have that same provision if they do not award funds by the end of June to renew the third quarter grantees that expire during that time. The other piece of the Consolidated Appropriations Act that's important to mention is that it also provided funding a little over $4 billion for next year's COC program. It also articulated that, gave some guidelines in there regarding Tier 1 funding. So not to get too technical, and we talked about this last time. So a community has to rank their projects in Tier 1 and Tier 2. Historically, 90% of the projects are ranked in Tier 1, and 10% of the projects or funding are put in Tier 2. Tier 1 is largely considered programs that are going to be safely funded, and Tier 2 lends towards the more competitive piece, the funding that your community is at risk. The NOFO that was released by HUD in November that is currently in litigation puts that Tier 1 limit at 30%, meaning that a much greater portion of the community's funding is at risk for being allocated to another community. So you see here in the Appropriations Act that they articulated that that the percentage can be no lower than 60%, lends us to believe that Congress is hearing some of the advocacy that is going on around this topic and considering it. And then HUD must release the FY26 NOFO program by June 1st and make awards by December 1st. So that right there provides HUD with a clearer timetable than they've ever had, and it will it ensures that there is no time lapse where projects are waiting to hear about their funding after their contract has lapsed. And that has happened historically for quite some time. There's always been this odd alignment timeline that has projects that have expired earlier in the year waiting to hear renewal after their contract has actually expired. So this timetable helps align the timeline to a pragmatic, logical timeline that will eliminate any gaps in funding. So I'm moving over to another topic, so I'll pause if the chair is comfortable, or would you like me to hit the last topic?
Well, I think we need a flow chart for exactly what you said. That was very complicated. So, in any event, I know you did a good job in trying to break it down, but it is very complex with lawsuit, with funding, diversions and everything. But Commissioner Spitzer.
Thank you, Mr. Chairman. All right, Doug, so what you're saying is this legislation cures a gap, assuming for discussion, they keep to the time frame. Is that correct?
So it eliminates a gap for next year, and it also ensures that projects will be renewed this year if the lawsuit or determination takes longer and longer to come to a conclusion.
So this legislation takes effect irrespective of the outcome of the lawsuit?
This is where I would lean on.
If you don't know, just say.
I don't know, because we have also not heard from HUD after this was signed into law, their movement towards renewing the first quarter's contracts already.
So what, if any, is your recommendation for what we should be doing as a county in this regard? What should we be doing in the interim as a county or a commission?
I think so I'll speak to the Office of Care Coordination. We are consistently keeping our Board of Supervisors informed, and also keeping the delegation, the Orange County congressional delegation, informed of with local impact. And yeah.
Okay. On that note, I just want to say for the record, at the last meeting with respect to the letter that we transmitted to the board, I had suggested it, so I take great responsibility and I watched the board meeting. I would like some suggestions from the chair or the vice chair about what, if anything, we should do different going forward. If we ever transmit anything to the board again, because the way that Doug was treated was abominable. It was irresponsible. The only other time I've seen the board treat a staff member that bad was when I was on the board and Sean Nelson caused the John Wayne Airport director to pass out at the podium. No county supervisor should ever talk to staff the way I witnessed that happen. And I called Doug and I, tried to let him cry, or I cried on his shoulder because it was not okay. And so the reason I'm raising it is because I don't want to repeat for our staff that situation again, because something maybe that we didn't do appropriate. So I'm asking a question, which is, what should we have done? What could we do going forward? Because I want to make sure we do everything we can to satisfy the board, right, in the transmission, share our opinion. I mean, we have a role, right? We're advisory. That's all we can do is give a suggestion. But I don't want to put our staff in harm's way in the future. So, Mr. Chairman, is there, in retrospect, with hindsight being more clear than I guess at that moment, I know you were suggesting that you just take the lead and do it. So did I blow it? I'm willing to take full responsibility by suggesting we do a letter. I thought that would be more powerful. But if you think we have a lesson learned, I would ask you respectfully to share it, because I don't ever want to repeat anything coming out of here in advisory capacity where it puts our staff in the way that Doug was treated. That is not cool. You cannot talk to and treat staff that way. It was not okay with me. And I do commend you, Mr. Chairman, because you did really go out of your way to protect him. And I thought you did a phenomenal job, but I don't want that to occur. So if we ever advise again, should we do it differently is my question.
Well, let me make sure, we open it up to the board, and I know Commissioner Nguyen was there, Supervisor Nguyen was there. So we had firsthand knowledge, and those of you who heard it or reviewed it later, it's never okay. It was really hilarious when you were starting out. You said last time you saw somebody, get
Press down.
pressed down, spoken down to, was when you were on there. I thought you were going to talk about yourself, and I thought, no, man.
I
No,
never
no,
did
no.
anybody pass out.
It's funny, because I mean, I was at a TCA meeting. TCA is a toll roads agency. And I was talking to one of the staff people there, and I was just simply asking a question. I mean, it wasn't a harsh question, it wasn't a difficult question. But we failed to realize being in front of a board or any commission and having to answer questions is difficult. It's intimidating. And her name was Barbie Denton. Barbie started crying, and Barbie's the nicest person ever, and I was just simply asking a question. But sometimes that dynamic is one that, I certainly felt for Doug, because I think, some questions are fair, some questions in delivery may be more aggressive, more adversarial than maybe some others. I think to your point, Commissioner Spitzer, I think, and I know we had a really healthy debate here at the commission before the letter was prepared and before we decided to deliver it. I think the question and the doubt for me was the timing of it, because what I heard from one of my colleagues, and I think it was Supervisor Wagner, was that he had very little time to be able to, respond, think about it, contemplate it. So to me, I just thought it would have been more efficient to have the chair, vice chair maybe sign off on something that we all agree on, rather than getting everybody's signatures. You all are so busy, we're all so busy, that it's just more the practical challenge to getting it to the board and the supervisors early enough so they can have an opportunity to digest it. So that was it was more efficiencies rather than power. There was definitely power in having all of us sign, but it was more the practical challenges that I worried about. So I think timing did work against us, because I think the letter may not have been delivered to all the board offices until the Monday night before the Tuesday meeting. We get things sometimes late. I didn't think it was a complicated letter. I thought, all of us have the ability to just understand it. You could call it Doug and say, can you expand on that? Unfortunately, it didn't work out that way. But yeah, I think in the future, we just have to balance the thrust of having all of us sign on and having those timing challenges versus just simply being expeditious, right, and getting it to everybody, all the board offices, so they can understand it. It's just my thoughts. Unless anybody has any.
Well, no, to your point, Mr. Chairman, fine. I think in the future, if we have some action we take, then you and the vice chair, or however you work it out between yourselves, your dynamic, then that gets transmitted however it is on an agenda item or discussion, whatever. However, that's your purview. We could always follow up later with something, right, a catch up. And if it's part of the record, it is, and if part of the record, it isn't. We'll just have to see how that goes. But at least that is a resolution and a solution to ensure that the same kind of issue that was raised in terms of timeliness does not occur again. And then we can still get our message across, but not at the risk of getting staff blamed for the fact that there was a delay. So I think in the future we should adopt that practice because we are advisory and we have a responsibility to advise. And I don't want to give up on our responsibilities because we're nervous about the timing. So with that suggestion, I think that's great, and I appreciate you allowing me the opportunity to address it.
Well taken. So to the extent, yeah, I think the timing of things worked against us. Unfortunately, last time it was sort of at the last minute, but we all felt so strongly. So I really want to thank you all because, it was an important issue for all of us, and we all felt compelled to do something, do as much as we could. So I certainly appreciate that. Yes, Commissioner Wayne.
I agree with the chair. Timing was important. I mean, remember at the Board of Supervisors, we just don't look at just one issue and that one day, that moment. We gotta look beyond that because there is a NOFA coming, the new one. Whether we like it or not, we can't, cut ourselves on this one issue and then jeopardize the future as well for the county. And so by throwing something at the last minute, I think one of our colleagues said they didn't get it till like 8, 9 p.m. Because, I mean, yes, you might have sent it to us by 4 or 5 o'clock. We might not have been able to check it until we get back to our house or whenever we are able to that evening. And so you have to understand that if you're gonna advise us, please do so, but don't put us in a position where you're forcing our hands 24 hours before, 12 hours before a vote. On top of that, we not only are we not only do we not have the information to look at what you've given us, but we also have to look at the replication of the future. There's a lawsuit that was coming, that was happening that same week. That lawsuit was going to be resolved or looked at by the court. That just puts us in a very awkward position. And not all of you signed on to the letter. So how was that? You didn't all sign on to the letter, but then you submitted as like the whole commission signed on to the letter. So if you can't get to your board to sign off for you to sign on to that letter, how do you expect the Board of Supervisors to also look at it? Because then we're looking at it, or at least I was looking at it, like, wait a minute, why is so-and-so not on it? Well, because of timing. Okay, so what does that say? Does he or she, his or her board not want to sign on to it? So those are kind of things that I think, going forward is that we are a commission to advise the Board of Suits, but also keep in mind, they don't just look at, or we as supervisors don't look at just that one isolated issue and how that would impact just that moment. We look at what could potentially impact us today and tomorrow and further on beyond tomorrow as well. And we also look at what our other agencies could be affected. And, I was in DC a few weeks ago. I would tell you, you already know this, but the administration is a very unique administration. It's not just an isolated one department or agency they look at. We could be penalized for everything just because we meddle in one area, one issue at that one moment. We could be the target of everything else of the county. And so, I don't think that, please advise us. And that's why my staff, when this conversation was happening, my staff's like, what do? I said, stay off of it. You can't jump on to wanting to sign on to something we didn't even have vetted through. Even in my own office, we had been have that discussion with you here. My staff was here.
Thank you for that. And I think, points all well taken. I think, getting information as quickly to the board offices as we can, I think that's important for us to consider whenever we deliberate on maybe some other communications up to the board. To your point, I don't know how we prevent any of our staff or anybody from being treated less than civil and less than respectful. That's just something that, just comes with, I think, just good character. So in any event, that's those moments.
And I apologize. I briefly mentioned I went to DC. We could not get a meeting with HUD into the very last minute because they had that letter you sent. And that was the exact reason why they said that they won't have that meeting with us. Into the very last minute when we were able to get a meeting with the White House when that phone call got called in to get us that meeting. We rearranged our schedule in DC just for that one meeting so we could get to HUD to talk about the NOFA, the future NOFA, not the current NOFA. And so why, like I said, is what we do here can potentially impact the county beyond just this year's NOFA. It could be the next few years. And so, that's where I think is, us trying to make sure that we isolate our issues and keep it within that because, there's other things that we have to deal with as a county as a whole. But I want to share that with you because we had a really hard time getting meeting. And when we sat down, that was what we were told.
And therefore, a very unique administration. But I think this also commission had a responsibility to make sure we advise the Board of Supervisors. So that is literally, how we are supposed to, fulfill our mission here as a commission. So I think, it's certainly a tricky environment that we, have to navigate under, but I do think that this commission certainly had the right intent, correct intent. So anyways, let me go ahead and, thank you for the comments. I'm going to go ahead and ask the clerk to read the next item.
Item 2 is the Office of Care Coordination update, which includes updates on the Continuing of Care Board membership, the OC Same Day Solutions Fair, 2026 point in time count, and the Homeless Prevention Framework Project. If you have no requests from the public, please be on.
Thank you, Doug. I'll turn it over to you.
Thanks again. So we just wanted to start off, there's a significant amount of overlap, as we all know, and coordination that happens between the work that we do here at the Commission and the Orange County Continuum of Care Board. And it's been quite some time since our office has just provided an FYI in terms of a roster of the COC board. The COC board had elections in December, and folks served 2-year terms. So very similar to here, roughly about half of the members were up for re-election. You'll see overlap between the two, some overlap between the membership as well of the commission and the COC. So we know we have 2 COC representatives on here with Santa Bob and Commissioner Faust. And then we also have overlap in terms of organizations where we have some commissioners here that serve and colleagues or staffs of theirs serve on the COC board. So we wanted to pass around, and it's in your packet, the updated roster of the COC. I think it's important to also mention, just like our commission, Orange County COC board elects a chair, vice chair, and they also have a secretary each year. And for this upcoming year, and currently their chair is our Commissioner Rios Faust, Vice Chair Nisha Mohendra, who is transitioning from Families Forward to be the new CEO at Friendship Shelter, and then Dr. Tiffany Mitchell, who is part of the leadership team at Orangewood. So we just wanted to provide just a quick FYI there. We're really excited to announce our next Same Day Solutions Fair. So next week, in partnership with Commissioner Trejo and his OC, we will be doing our sort of rain check Same Day Solutions Fair that we planned on doing. I think it was in late November, but it got rained out. So we're excited to host and have our Same Day Solutions Fair next Thursday, February 26th at Placentia Presbyterian Church. As many of you know, and we have the flyer in the packet, so many of you, if not all of you around the table, play really big roles in the Same Day Solutions Fair. It provides, it's an event that provides just a whole host of resources, anywhere from shelter to legal help to hygiene to behavioral health services to benefits, all in one place. This will be our 4th Same Day Solutions Fair from 9 to 2. We open it up to anybody experiencing homelessness, really anyone who walks through the doors of the Same Day Solutions Fair is welcome to come and receive services. And we always talk about, obviously the value of an event like this is that people who are experiencing homelessness often need many different resources that requires them to travel to many different places over a series of days and weeks, where an event like this brings it all to one place. But it's also shown itself to be a really good opportunity for all of what I'll call the vendors or all the services that show up to reconnect with each other. It's a great networking exercise. And it's also just a really good reminder of the great work that's happening throughout our county by many different groups each and every day. And on these particular days, it happens to be happening in one place. So, we've had 3 of them. They've been out really outstanding. We're having our 4th next Thursday. And then we have committed for the calendar year of 2026 to have these events on a monthly basis. So we did not have one in February, we had the point in time count really was our main focus. We have our one in February, and then in March, we'll be back in the city of Orange at the Hub, the drop-in center in the city of Orange. We've contracted with them to conduct the same-day solutions fair every other month, which is really exciting. As a drop-in center, they're like a fantastic place to find folks that are ideal for this particular event. And they're fantastic partners, and it's centrally located in the city of Orange. In April, we'll be in the city of Costa Mesa, and then in May, we'll be back at the Hub in Orange. When we come back in April, we'll have hopefully dates all the way through the end of the calendar year. Like I said, our thoughts are we do sort of the different cities once every other month, and then on those off months, we have one at the Hub in the city of Orange. So we hope to see as many of you there as possible, and please continue to spread the word about the event on Thursday. All are invited. Wanted to quickly touch base and thank everyone for the point in time count. So as all of you know, here in Orange County, as part of the requirements for a continuum of care, the Orange County Continuum of Care conducted the 2026 point in time count the last week of January. And as most people view this event specifically for the unsheltered portion of the count, where over the course of 3 days and a little over 1,000 volunteers, we as a community go out and count and survey everybody who is experiencing unsheltered homelessness during that period of time. Just some of the basics that I like to share after the event, especially during this time between the event and when we have results, is that we canvassed all the maps. We canvassed all of Orange County during the period of time we covered every single map, the amount of times the methodology requires us to cover every single map. We saw many of the folks around this table there volunteering, which we really appreciate. Not only did we see many of you volunteering, but we saw many of you bringing your teams to volunteer, whether it was staff, board members, colleagues, and as it being such a volunteer-based event, and we really appreciate your leadership in coming and partaking and showing the value of and the importance of the point in time count. We want to make sure also that we thank, because as many of you know, and as I described, it's roughly an event that happens over the course of a week, but like any event that happens over the course of the week, the planning part of it happens and starts 6 to 8 months prior to the event. And there's so many important groups alongside the county that made this particular event successful. My colleagues here at the county, CalOptima Health, who not only showed up in large scale like they always do in volunteers, but really helped fund the actual event. CityNet, our partners who are the project lead, United Way, who also fills the event with volunteers, but also provides the hygiene kits. They're also the HMIS lead that handles the sheltered portion of the count, which is not as familiar to everyone, but incredibly important as well, and a whole bunch of work. Hub for Urban Initiative, obviously our COC, because it's COC led. And then very importantly, all 34 cities. We canvass every ounce of the county, and it's that requires we go and count every single one of the 34 cities, and that requires us to partner with city managers and their teams and their local law enforcement groups, both prior to the event and then during the event. And without that type of cooperation and collaboration, it would not operate as smoothly as it does. So I wanted to take a few minutes to really make sure we thank folks. And then lastly, we wanted to introduce an effort that the Office of Care Coordination is contracting with the Corporation for Supportive Housing over the next couple of months. So very much motivated by this commission's leadership, our chair's leadership in the prevention efforts, and the focus on understanding how important homelessness prevention is to helping reduce homelessness here in our county. Our office has partnered with the Corporation for Supportive Housing to help us conduct a landscape analysis of the different resources here in the community. And the reason I mention that is because of a couple of things. First, in terms of like very specific traditional homelessness prevention programs. When I say traditional, I mean, rental assistance and what most people think of when they think of homelessness prevention. Although we don't have large-scale homelessness prevention programs here in the county, we do have a variety of them that help different people. And incredibly important, we have our homeless prevention and stabilization program here that the county funds, and the supervisor has put additional discretionary funds in to support his district. That's really been impactful over the last 2 years. So we have these variety of programs, and our office is always in an effort to play a coordinating role, needs Corporation for Supportive Housing to help us really catalog those, as well as the importance of reminding us and the community, as we saw in the 2025 homeless survey, the value and the importance of how prevention is something that happens on a spectrum and all the way upstream, meaning the importance that not only like our housing authority has and the 4 housing authorities have with programs like Section 8 that are essentially a homelessness prevention program in themselves, but the behavioral health programs that we have, as we saw in the study. So many people spoke about challenges with behavioral health issues that were part of what led them towards homelessness: employment, relationship issues. And here in Orange County, we've built a system of care that helps support many of those areas. And we want to make sure that we're able to articulate those efforts in the spirit of ensuring that we continue to fund the solutions that we know. So I say all of this to state that the Corporation for Supportive Housing, in partnership with us, will be reaching out to many of the folks around this table and your organizations, because one very important piece of being able to achieve a landscape analysis is ensuring that they speak with all stakeholders and get a real understanding of not only the services that are out there, but what each particular group is seeing, whether it's in gaps or needs or folks walking through their door asking for assistance. So I ask all of you to be on the lookout for correspondence from us soliciting your advice and time, whether it's you or your staffs, to contribute to our landscape analysis. And we'll report on the progress of this particular effort in our next meeting. And just as a little, the contract goes through the end of June, so we hope to have this all tied up by the end of June. We're not looking for a project, this never-ending project. So we will be excited to share our findings in our April meeting. With that, I'm done with my updates, and I'll pass it back to the chair.
Thank you, Doug. Let me go ahead and bring it back to the commission to see if there are any members that have any questions, comments on any of the updates, the COC, the same-day solutions, the point-in-time count, or the prevention framework. Yes, Vice Chair.
Thank you. I just wanted to say thank you to the staff and to the United Way sitting in, all of the people that were involved in the point-in-time count. That is something that I encourage my team, my board members to do on every other year basis. Since we have taken over the Los Angeles area, I've committed myself to going up to LA next year. Wish me luck to do their point in time count, but it really helps us understand where people are at. And there are so many people that I encountered that were outside that morning without socks on. And I was grateful for the team of volunteers that had those for all of us, because people should not be sleeping outside to start. And they certainly shouldn't be sleeping outside without socks on. So encountered most people who were willing to speak to us. Most people told me they were on a waiting list for shelter. So very important. Thank you for everyone that was involved, for all of you that got out of that little morning and stayed up late in the evening and did the point of count.
Thank you, Vice Chair. Any other comments, questions on any of the updates? Yes, Commissioner Hurst.
Can you clarify on the last item, is this homeless prevention, or, I mean, is the focus of that report going to be preventing homelessness? In specificity is what I'm saying.
Yes. Yes. But yeah, it'll be that. I know I gave you a short answer. Is there something you're looking for
it's
there?
probably,
Okay.
the short answer is probably right. Yeah.
Okay.
I mean, it's a big subject to get our arms and mind around. I mean, are they focusing on keeping people from entering homelessness or resolving current homelessness? I think those are two different.
So they're interested in doing a landscape analysis of the services that are provided here in Orange County that help keep people from entering homelessness.
Perfect. Thank you.
Great, thank you. Seeing no other, yes, Commissioner Parks, please.
Okay, thanks. I just had three things. One, congratulations, Maricela, and thank you for stepping up on that, for leading the COC. Two, the point in time count was very smooth, and again, a huge thank you to the staff. I'll echo that. I thought when we had a police officer join us, I was in San Clemente, and he had not read all of our studies and all the research that had been done, and he was sharing with us his perspective, and he said, somebody runs into financial trouble and they end up losing their home, they live in their car, at some point they can't get to work because they can't keep up the payments on the car, and then they'll end up on somebody's couch until they wear out their welcome, and then they become homeless. And it was just so profound to hear it, because he knew every single person that we talked to. And there was this message there about how important prevention is, because if we had interceded in this whole beginning downward. So I love that you're looking on prevention, and so that was my third point. Are you looking for just the programs that the county's funding, or are you looking for other programs that we might be leading on prevention?
Yeah, it's a county-wide one, not just the county of Orange. So that's why the call out to a group like this will be so incredibly important, obviously, to my mind as well.
Yes, thank you for those comments. The point in time count was very, again, as it is every time we do this, it does, make us contemplate on what we speak about here and actually what is happening out there, right? And so it does, create this nexus that if you don't experience it, you don't see it, you really can't appreciate what we're all trying to resolve and address here. So I want to thank all the partners that showed up. On the framework, on the prevention framework, for those new commissioners, this has been a topic because it's one of our 4 pillars of prevention that I know this commission in particular has been really strong about, because we had quite a few surveys, presentations that were brought to this commission talking about, how do you address homelessness effectively. And I think too, the one consistent theme amongst many of those national studies, state studies, local studies seem to say, try to lean in on the prevention, right? Because on the cost effectiveness, it was almost, I think, 1/10 of the cost to keep somebody housed versus trying to house somebody once they're on the street, suffering trauma, having ancillary impacts, whether they're, substance use disorders, whether they have other medical issues, but keeping somebody housed is certainly the most cost-effective, efficient way. So I certainly appreciate this commission embracing that, and I think you're seeing that by many other efforts where people realize we just have to find somebody before they're falling into homelessness, whether it's a catastrophic injury, a loss of a job, whether they're going through an unlawful detainer or eviction action, you can see it, and you can see those steps, and I appreciate Commissioner Parks talking about it, because when a person is telling their story about the spiral down to being homeless, there are steps. There's a person who has a home, they're gainfully employed, they're healthy, and then you see this decline. And so to the extent we can find them, and it's a lot like the justice impacted, when you talk to people who are justice impacted, we had the benefit of visiting with some constituents of ours who are LWOPs. They're considered inmates who are incarcerated with life without the possibility of parole. They'll never see the outdoors, but one thing I analogize those conversations to what we're doing is they said, if you can find them early before they make those wrong decisions that we made, it is really important and compelling. So, look at those people who are in juvenile halls, juvenile detention centers, incarcerated for whatever reason. And I see that same analogy and that same approach here, where if we can find somebody before they start faltering, and you see these studies that show the delta between somebody being housed and somebody being homeless is about $300 to $400 a month, is what it takes to keep somebody from being on the street. So I certainly appreciate what all of you have shared with me in here and the discussions that we heard and the people who heard us. So I think that's what's driving this, and I see, the Samweli Foundation, if you saw the article that we run a few months back, they certainly see that as well. So you see the philanthropic community understanding where's the money best spent. Is it on, you certainly don't want to abandon treatment as people are on the street. You don't want to abandon creating housing, standing things up. But we also realize that maybe our money is best spent preventing people from being homeless. So in any event, those are my thoughts. Thank you for that discussion. Madam Clerk, if you'll please read the next item.
Item 3 is the Commissioner Spotlight, given by Commissioner Dr. Veronica Kelly, the Behavioral Health Representative. We have no question of public to speak on this item.
Great, thank you, and thank you, Commissioner Kelly, for allowing us to delve into everything. Not everything. Commissioner, and your professional role as HCA director, but thank you for allowing us to spotlight.
So I'm going to talk about the healthcare agency. I don't know that everyone, probably many of my staff don't know everything that we do, but I want to make sure you all know so you know what resources are available. So we are divided into behavioral health services, correctional health services, public health services, and specialized medical services. You're probably most familiar with behavioral health services. We are a specialty Medi-Cal provider. That means if you have a mild depression, your dog died, and you're having difficulty dealing with that grief, you would not come to us if you have Medi-Cal. You would go over to Dr. Bruno Nelson. So CalOptima and Kaiser, the managed care plans, are the ones who address mild or moderate mental health issues. We, on the HCA, are addressing severe. And that's a clinical determination. It's not just that you see someone who looks like they must be very sick. That's not the determination. So if we saw someone who was unhoused, were able to talk to them and do an assessment of them, and they did not meet the criteria for a severe mental illness, then we would do a warm handoff to CalOptima or to Kaiser. If there's someone who, and again, we serve the Medi-Cal population, we don't bill insurance for anything. So, although we'd like to, but that's a whole different story. And we also are the safety net, so we will provide specialty behavioral health services. If someone has a substance use disorder, we are the ones who provide the care. We split some of those things with our managed care plan, so that CalOptima and Kaiser can do medicated assisted treatment, giving medications to assist in someone's treatment from an SUD, and some very minimal other things. But if you need residential treatment, you need detox, we're the ones who provide that. We serve all ages. So we've had children as young as 3 and 4. We've had very sophisticated plans for how to complete a suicide. And we go all the way until someone is an elder. We have specific specialists we have pediatric psychiatrists who work with pediatric neurologists who can work with our children and our youth, as well as gerontologists who work with our older adult population. We address forensics, so we work with our law enforcement partners. Anyone who's involved in the criminal justice system who has a serious mental illness or a substance use disorder. So we serve those folks as well. That includes people who are incompetent to stand trial, that whole population, anyone who's in a collaborative court, whether it's drug court, veterans court, homeless court, mental health court. We are the ones who provide the treatment and the evaluations for all of those courts. And most of those are not funded services that we provide. We just do that in particular because it's the right thing to do. We have the entire continuum of care for substance use disorder. So from prevention, 20% of all of our SUD funding has to be used for prevention. So we do the prevention part. We do treatment and then recovery support as well. We offer the entire continuum, just like we do on the mental health side. So outpatient services, intensive outpatient, residential, and for the mental health side, we do long-term care. We do crisis and acute care. So lots of you are familiar with the crisis assessment team. Many of our partners in the community call us all the time because someone might be unhoused and they want CAT to go and evaluate them. And we do. But because someone is not housed does not mean they meet criteria for a 5150. And so that's really important to know. We are meeting with different community groups to really explain what that is. And that a recent Senate Bill 43 expands the definition of grave disability to add inability to keep oneself safe and inability to make medical decisions. Now imagine you have a clinician. It's not our scope to look at medical, or you have a law enforcement officer, not their scope. Now it's become our scope. Just as an aside, we have always placed someone on a 5150 hold who might have meth-induced psychosis. We've always attended to substance use disorder. The challenge is, once they're on a 5150, so they're held for 72 hours involuntarily, they're reassessed during that period of time by a designated facility, and individuals were designated by the behavioral health director to write and release a hold. If they clear, which if you have meth-induced psychosis, you will clear for a little period of time, they must release the hold. And the holds are released not by the county, those are released by the facilities. So I really want to say that because our hospital partners are very essential to us in this place. And we are working very closely with them because we do monitor where our holds are released and if those folks come back to see us. So that's, we really look at that. So 9,605 CAT responses where our team actually rolled out and did an assessment on an individual. In addition, we go out there, we had an additional 1,500 dispatches because we might go out, they don't meet criteria, we come back into the office, we get called again because now they've escalated, and then we go back out. So we have 41,885 OC links called. That's where you call if you want to get the CAT team to deploy for you. That's a lot. We are working hand in hand with our sheriff's department on assisting them with their new mental health protocols so that we can work more collaboratively, right person at the right time, that perhaps what you need at the time that you call is a clinician, not a cop. And so we're doing that. I thought it'd be important for you to know that about 10 to 15% of the 40,000 people we see, unduplicated people, identify as being unhoused. And they often will use our address at the clinic as their address, but they do come in to see us. So that's an important thing to know. We also assist with housing for people who have a serious mental illness. And so behavioral health bridge housing, I think you all are aware of that. That's funding we got from the state. We have a number of providers who provide that. That's short-term housing. You have to have a serious mental illness in order to get in there. And again, it's not long-term housing. We also have used our Mental Health Services Act dollars with OCCR, our colleagues there, to stand up permanent supportive housing for people who have a serious mental illness. And probably, you know, for all of this, for us, when we're placing someone, we talk about placements, it's treatment. It's not housing. It keeps them housed, but it really is treatment. And that's what we provide, this treatment. But recovery residences or sober living environments are for people who are recovering from a substance use disorder. And the ones that we are working with, they are reviewed by the sheriff. So they must meet certain criteria, and we have criteria for them as well. And the folks who are living there who are seeking recovery from a substance use disorder also are seeking employment, school, volunteer opportunities, and are urine screened, and must be involved in our treatment program. So it really is more treatment than housing, but just so that you're aware. Correctional health services, we work in the sheriff's jail. We are there 24/7. We provide medical, we provide behavioral health, pharmaceutical, nursing services, specialty services, and dental to inmates. We have developed, these numbers are all from January through September. So 2,073 on-site services, 3,430 delivered off-site. That's because the acuity of people who are in jail is much higher. You have so many comorbidities, so many medical issues that if someone needs dialysis, we got to take them out to a hospital. If they have a heart attack, they go out. So we've seen a huge increase in that, just that people are sicker overall. We have a dedicated LPS unit, so that's a unit where someone can be placed on hold against their will again, although they are in custody, so it's against their will. But it keeps them safe from general population, and they're attended to very specifically. So we have 10 female beds for that, and we have 15 male beds for that. Our average daily census for the correctional side, 2,126 inmates who have a mental illness that's requiring services. That number continues to go up for the folks who need assistance. And we have dispensed over 3 million medications. So we dispense quite a lot of medications. We also provide health services for juvenile health. So work with probation and social services in their residential facilities. We provide the medical unit for youth who are in Orangewood who come and go sometimes and who have maybe been unhoused. And have had 44,826 intakes. Those are the medical evaluations that we do in correctional health, and 144,523 nursing encounters. Again, we do that right now 24/7. Public health services. We do clinical services in public health, immunizations. We have a clinic, HIV testing and care, and our pulmonary disease clinic. These are really impacted by unhoused people. And in conjunction with the Communicable Disease Control Division, we've had in that last year 6,898 disease investigations. Our biggest ones are Legionella, which is waterborne, and 455 outbreaks that we've investigated. Last year we had an outbreak of unhoused people, 2 groups in Santa Ana. So we knew where they were. We were able to deploy outreach and engagement to go out with our public health nurses so we could treat them. The first group was young unhoused men who were HIV positive and using needles. So that we wanted to attend to them as well. The other group were sex workers, and because of the mobility of that group, we were going immediately, because while those sex workers were unhoused as well, their clients probably were not. And so it is really imperative for us in this space. Unfortunately, we're losing a lot of funding in this area, but we work very closely with outreach and engagement and other providers so that we can get out and attend to the communicable diseases in particular of folks. That also includes tuberculosis, which we have a lot of challenges with. And when we are working with folks who have tuberculosis, we can, a health officer can place them on hold, and we can place them in housing while they are mandated to provide their treatment, and we do that as well. We provide community nursing division, that's home and community nursing, and including health case management. We work with unhoused individuals in this regard, doing the case management, and also foster youth. And we've served 6,464 people in the last year, 1,300 foster youth as well. Environmental health, that's all the regulatory stuff to make sure your restaurants are clean and that you're not going to get sick there. And it also includes our food trucks, public pools. We inspect all of those and all those spots that you might see at a hotel and you wonder, should I go in there? If you smell chlorine, yes. If you don't do it. We do lead poisoning prevention, water quality and ocean water protection, hazmat, so with the runoff from the storm, we are looking there. We work very closely with Public Works because we'll be areas where unhoused folks are. We are part of that group. We address above and underground storage tanks and body art facilities and used oil. It's a big menu of things we do there. We do health promotion, so tobacco use prevention. We're doing local health, oral health programs, nutritional services, and then we have a lab. Our lab is, we run all of our water through there. We can do disease surveillance to see if there's a lot of COVID in wastewater, that sort of thing. We can surveil, obviously, infectious disease through that lab. foodborne disease, and we're also a level B lab for the CDC Response Network for Bioterrorism. Then our specialized medical services, California Children's Services, that is medical care for eligible children. We serve 11,000 children and their families through that. Emergency medical services, that's all pre-hospital, so ambulance services, working with fire, Orange County Fire Authority, all of our emergency rooms. We are more regulatory, but work hand in hand with all of our partners there. We provide employee health for almost 20,000 employees. We are the medical safety net. Medical safety net in this county does not provide comprehensive medical care. We're very different than other counties in this regard. We have an ordinance that the board approved. You must qualify, and you must have three things. You must be a citizen of the United States in order to qualify for this. You must have life or limb impacts that either you will die or you will lose a limb if you don't get the treatment, and we only provide it for 1 year. So very different. MSI, or MSN as it's also called, is very different in other counties, and I know that this has been a big interest for community providers with us. And then, of course, we have the Office of the Public Guardian. We've had 516 referrals this year. We manage 1,584 people who are on conservatorship, and we manage about $30 million of their assets. So that's kind of what we do. We see ourselves as being in the prevention space to prevent people from being unhoused. If we can help stabilize their mental illness or their addiction, then that really does assist them in maintaining housing. We also work with the providers of the housing, so we have residential treatment. We have room and boards, board and cares that our folks live in. We want to make sure that they're stable so they remain housed. And we work very closely with OCCR and all of our other partners to ensure that if it's someone who has a behavioral health issue, let's pull them off of your waiting list and put them in ours so that we can use our specified services so that allows someone else who's unhoused to be in the spot that you have. So happy to answer any questions if you don't have any, but I'm here to answer if you have any.
It's pretty comprehensive. Thank you. Thank you, Commissioner Kelly. And because, the commissioner is new to us, I thought this was even, a more timely spotlight. That way we all understand like how many hats she wears, how many issues she oversees, but yeah, that's probably just a small snapshot of what she does altogether. But thank you, Commissioner. Commissioner Bates.
I have two important comments. The first one is wow. And the second one is thank you.
Thank you.
I thought this was about what you like to do to have fun.
It is that too. I
You
know.
like to go to concerts. Oh, you're not going to answer that question?
Occasionally.
It's amazing work. I don't even know how you can wrap your arms around all that one agency. So kudos.
Well, and we have a lot of resources. So it's just connecting all of you with the resources we have. Our resources are dwindling, but that doesn't mean we don't have them still. So it's really important. Again, if you have any questions about the services we deliver, there's our information. You can just contact me and we can make sure that we connect you.
I heard Doug has a lot of money.
Michelle's face.
I wish he did, but he doesn't.
So that was helpful. I'm like, okay, I'm gonna be quiet.
On that positive note, let's go ahead and see no other questions or comments. Thank you, Commissioner Kelly, once again. So let's move along to our action items on the agenda. Madam Clerk, if you'll please read the next item.
Item 4 is a recommendation to approve for appointment candidates to serve on the Commission to Address Homelessness to the Board of Supervisors for final approval, including Adam Foster, Chief of Police for the City of Buhara as the Chief of Police Representative, Gina Cunningham, Executive Director of OCLA as the Affordable Housing Development Industry Representative, and Kelly Bruno Nelson, Executive Director of Cal Optima Health as the Medi-Cal Managed Care Health Plan Representative. And approve the launch of a recruitment process to evaluate and make recommendations for appointment for the Orange County Sheriff Coroner Department representative. And we have no request from the public to speak on this item.
And then, of course, let me begin by just thanking the membership ad hoc committee for their work and their support in the recruitment of these aspiring seats, and working to review the applications, making sure they make solid recommendations to the commission, and I'll turn it over to Doug for more details on the recommended candidates.
Yeah, thank you, Chairman. So at our December meeting, the commission approved the launch of the recruitment process, and it also established a new membership ad hoc to evaluate and make recommendations for appointment to expiring seats here at the commission. So the 4 seats, as mentioned previously, that were recruited for in the last 2 months were specifically the chief of police, the affordable housing development industry representative, the city manager or elected official in the North Service Planning area, and the Medi-Cal managed care health plan representative. The Office of Care Coordination opened up and launched an application period starting December 16th for these 4 seats, and those candidates had until January 23rd to submit their application. The membership ad hoc, as you can see up here, the members of those ad hoc, that ad hoc, reviewed all of the applications that came through for those seats, and at this time are bringing to the commission for recommendation Chief Adam Foster from the city of La Habra to come on to the commission as the chief of police representative, Gina Cunningham to be reappointed as the affordable housing development industry representative, and Kelly Bruno Nelson to be reappointed as the Medi-Cal managed care health plan representative. As a reminder, the way this process works is that the commission will vote on these members, and if that passes, that will be a recommendation to bring these members to the Board of Supervisors for them to make this appointment. We did have, we are not, or the membership ad hoc is not bringing forth at the moment a candidate for the North Service Planning area. The ad hoc is still working through that particular seat. As those of you who've been on the commission for a period of time, you know that every once in a while, and a little bit more than every once in a while, when we have these batches, sometimes some of the seats are a little easier to go through for the membership ad hoc, and then some of them take a little bit more time to suss through the application. So this isn't anything out of the norm. Hopefully there'll be, so we will bring an update in our April meeting for that particular shift. Then I do want to mention that the last, or 4B, is seeking approval to launch the recruitment process to evaluate and make recommendations for an appointment to the Orange County Sheriff Coroner Department representative. So Commander Assumption has been reassigned as his role at the Sheriff's Department. And with that reassignment, will not be overseeing the behavioral health and a lot of the work that we do here. Now, the commander's been on for a short period of time, but I do want to mention he was part of our membership ad hoc and has been a great partner with our office for quite some time, and that will continue to be the case. So with that, I'll pass it back to the chair.
Great, thank you. So, Commissioner Assunción, did we scare you off, or did you answer after you maybe heard the meeting, or?
No, what I could tell you is when I did apply for the position here to be part of the board, I was assigned to patrol operations, and in between that time frame, and I think right before I got sworn in, I got a phone call from the sheriff to present me another opportunity within the sheriff's department to take on a challenge. And of course, he's my boss, so I couldn't say no. So with that being said, I think it was just smart for me to step down and put someone in here that will be here and that could give that full commitment to the commission.
Can I add one detail? I'm sorry, Mr. Chairman. Commissioner Assunción is going to attend our April meeting as well. So by launching this recruitment and the way that the time works, hopefully we'll be able to bring a recommendation in April and have it seated in our June meeting. So with this timing, hopefully we won't see a gap in Sheriff's Department representation on this.
Well, thank you for hanging out with us, at least for a couple of meetings. That's good. I appreciate the transition. So it's a two-part motion vote to approve the launch of the recruitment to fill Commissioner Asuncion's seat and also to approve 3 new commissioners or
I'd like to break it up because I have a question. Can I move the 3 recommended actions of Foster, Cunningham, and Bruno Nelson?
We have a motion for Part A. Is there a second? We have a second by Commissioner Parks. All those in favor?
Aye.
Those opposed, motion carried. Motion carries. The next item is to approve the recruitment. So go ahead.
I have a question about that. Why isn't it the sheriff who decides who's going to sit here?
So we've run this recruitment before. The way the bylaws read, all seats are recruited for except for the 2 appointments, or the 2 appointments from the board and specifically the district attorney's seat as well. So
Yeah, but mine says I can't have a designee. I have a restriction, I believe. I don't know, whatever. But I'm just saying the sheriff makes a decision, like so I don't get it. Is it kind of just a fake? We just kind of fake it and then the sheriff makes a decision, we say, okay?
no, I mean, ultimately, the sheriff makes a recommendation, the membership ad hoc then, reviews that application, brings it up.
Okay.
I understand what
I just hate to waste everybody's time on something that is out of our hands. And so if really the sheriff makes a decision and the ad hoc the sheriff can say, it's powers with the sheriff. It's his department, and it's generally been the person who oversees behavioral health, right? Hasn't it been that commander?
The seat is, technically, all these seats are appointed by the board ultimately. And then the way the bylaws are written, is that as one representative of the Orange County Sheriff's Corner Department in a leadership and/or command level role with knowledge of the Orange County system of care. So several of these seats are very limited in who can apply for them. I mean, I think the seat that Commissioner Bruno Nelson sits
Whatever,
in.
I'll move the recommended actions. I just think it's stupid, but okay, fine. Kind of dumb.
I definitely understand that. I guess according to our bylaws, we have to go through our own recruitment, even though it's dictated, by the agency. But anyways, we have a motion by Commissioner Spitzer. Is there a second? A second by Commissioner Rios Faust. All those in favor?
Aye.
All those opposed, motion carries.
Then I have a third, if I could.
Yes.
On the city manager. With all due respect to Jim, good guy. Sorry he went through what he went through at the city. I can't talk more about that at this time. But the city manager, as she leaves, it's so important, that person, right, the spa representative, and their attendance is really important. And his attendance, I haven't checked the records, I didn't do that, but my recollection is he missed quite a few meetings. So how do we make sure we're getting robust and full participation from the city managers? What is the ad hoc's conversation gonna be about that? And should we share some sentiments with the City Managers Association? Or at least maybe go to the city managers meeting, I think they meet once a month, and talk to them about this. We don't have any services in the south. That's been a frustration. It's kind of status quo, right? Are we making progress through the city managers?
Yeah, I think I served on one of the membership ad hocs that did do a search, and I believe it was Commissioner Kim, who was the representative. I know her attendance was pretty strong and she was steady here while she served. I don't know what was going on with Commissioner Vanderpool at the time, so his attendance was much spottier, maybe for obvious reasons or other reasons. But to the extent that it's a fair question for those who serve on the ad hoc to be sort of a premise question, right? Can you make these meetings? I mean, that should be baseline. If somebody has, we all have challenging schedules, but you're all here. So to the extent that city managers have a busy job and busy agenda, so do all of us. But that is, I think, a fair question for any new members who who sit on the ad hoc to ask of any candidate, can you attend? And I think we have something in the bylaws that if you don't attend a certain number of meetings, is that something that,
I'm looking at the bylaws now. We don't have specific language that says if you don't attend X amount of meetings, you cannot be part of the commission. The first duty of the members, so section 6, section A, it says members shall attend meetings of the commission and committees of which they are appointed. I know that this has been brought up in the past. I think that, attendance across almost all commissioners has been very strong. I think that there have been 1 or 2 cases where that commission member attendance hasn't been, I think, as thorough as we'd all like it to be, but that's more the exception than the rule. And we do our best as an office to really communicate with each commissioner the importance of showing up to the meetings.
My point's way simpler than that. It's not just attendance. It's participation and commitment. I mean, everybody around this table is bringing something to the table and they're offering something, right? All of our organizations are bringing something, whether it's custodial health or dealing with the homeless, or I'm right the fairs and trying to do the court, like probation is going to have these vans. I think some of you were at the press conference where we're going to be doing court in the community, and I'm going to be trying to clear the homeless warrants so we can get them served. Like, we're all thinking and doing stuff. So it's not just whether you're fulfilling a seat. It's like, are you here with a seat, and are you actually committed to the mission of trying to address homelessness and actually bring solutions to the table? So I guess I would just say to the ad hoc, like, I just don't want a city manager. I really think there needs to be an important conversation with the city managers. Get us somebody who really is working in their career to be part of the solution in our county. So that's my only point. And maybe it's Anaheim again. Anaheim, I guess, I haven't been keeping up exactly. I'm sure they're going to be doing a search for a new city manager. They might have an interim. Maybe it's Anaheim. Maybe we say we should wait because there's such a big city in the North Spa. And we should wait until they get a city manager because that person's going to be critical to this conversation. I literally don't know the answer and I don't know their timeline, but we need people who are coming here with the commitment.
So one thing I'll say briefly is we did receive applications. It's not just a city manager, it can also be a local elected official. We did receive applications for this seat. There is a reason why there isn't a recommendation today for the particular seat. Because I think the membership ad hoc is committed to make sure that exactly it's not just someone whose name is on this roster that may or may not show up. But as I look around, especially this room, and the changes over the 5 years I've been here to the membership, and I can speak to each and every one of the members around this room that has had that commitment, and I think that and I appreciate the pointing that out even further. But that is, I want to speak for the membership ad hoc. That is a commitment of the membership ad hoc.
Thank you. I'm serving on the ad hoc. I just want to encourage the commission. The spirit with which you're speaking is represented on that search, which to Doug's point is one reason you don't have a recommendation today. Yeah, absolutely. Thank you.
Thank you for that. I think that dispenses with that item. Madam Clerk, if you'll read the next item, please.
Item 5 is to nominate and appoint the 2026 chair and vice chair to the Commission to Address Homelessness. And we have no request from the public to speak on this item.
Thank you for that. So for the nomination process, I'll open the floor for all nominations before I call for the vote. Before we begin, I want to provide additional information on the nomination process. Nominations can be made for the chair first or as a slate for both the chair and the vice chair together. Each nomination must have a motion and a second, and each nominee must accept the nomination. If a nominee declines, a motion will be considered withdrawn. After nominations are made and accepted, I'll take a vote for each nomination or slate of nominees. The nominee or slate of nominees to receive a majority vote will be appointed chair and or vice chair. If the first nomination is for chair only, I will follow the same procedure to nominate the vice chair. So I will open up the floor for nomination for chair or slate of nominees. And I do want to take some, privilege as serving as your chair and thanking you all for the confidence and trust you've had in me to lead you and be being able to manage these meetings, listen to all of you. I think this commission is one that I've been proud to serve as its chair, and I want to thank you all for your support because I've spoken to almost every one of you, and we've had conversations about the mission that we have here and the importance of what the subject matter is. So I just want to thank you for that confidence that you've shown in me, and I do want to open it up by making a nomination for a slate, and I want to nominate Vice Chair Cunningham and Commissioner Hurst as Vice Chair for the slate of leadership going forward. That will be my motion. I want to first of all, ask them if they are interested.
Absolutely.
Thank you. Thank you.
So there is a motion on the floor. Is there a second?
I'll second it.
We have a second. I think Commissioner Wynn, Commissioner Parks, but we'll go ahead and do it that way. So we have a motion and a second. Are there any other nominees, nominations for chair or vice chair or slate?
I don't have an alternative. I just have a point of order. I don't know how to frame it. Isn't it typical to have a county supervisor? I don't get it. The chairman of the board has appointed you all right to your appointments, and I got the list. And the two of you are here. I don't remember historically. Isn't it like pro forma? What do you do? To sit here as a normal member of the commission then?
That's what we do already.
No, you're the chair. And she's
I know, but I've served here as a commissioner. So I know when I was first appointed by the chairman at the time, who was Supervisor Wagner, I was just another member of the committee.
But who was the chairman at the time?
He was.
That's only.
Yeah, but I don't think that's in the bylaws.
It's not. I'm asking for purposes of, with no disrespect to anybody who's been nominated, okay? This isn't about that. I'm just asking if the commission should be headed by a county supervisor. Doesn't it carry a certain imprimatur when it's that way? I don't know. I just think historically a lot of our committees around the county are like juvenile justice coordinating. No, that's the Chief Hernandez, but the Criminal Justice Coordinating Council is chaired by Doug. So I'm just, isn't it kind of carry gravitas?
Let me give you an example. Cal Optima Health, county's public health plan, $4.5 billion agency. It's been led by two non-supervisors, and two supervisors sit on that board.
But that's a different.
Nonetheless, but it's still, so I get your point.
Aren't you the chair now of Cal Optima?
But I wasn't at the time that I was appointed. And neither was Chairman Chafee.
And I was on Cal Optima, I wasn't the chair.
Understood. So I guess to your point, I guess I will push back as I normally do. I don't think that anybody here shouldn't have the opportunity to be in leadership, whether or not they're a supervisor.
Okay.
I think to the extent that you're a supervisor, if there's an opportunity to serve, it's great. If there isn't, I think there's plenty of capacity to lead this.
Okay, perfect. You answered my question. It's not necessary. That's great. Okay, thank you.
Any other comments or questions? Yes, Vice Chair.
I believe when the commission was first started after the 10-year plan to address homelessness was done here, that my predecessor, Scott Larson, was the chair.
Right.
I think you were sitting on it as well.
Likewise, I don't know. I'm getting
I think
older.
it hasn't always historically been an elected, but just wanted to thank you for your comments, Commissioner.
Just following, I'm just out of curiosity. Has it always been a chair or a vice chair as county supervisors? No?
Probably not. I don't know.
And I think, I second the motion, it doesn't matter with me. I think comparing this to Cal Optima, it's night and day. It's like OCTA and Cal Optima are more similar than this commission. This commission is actually a county agency commission. So I think that comparison, I think it's not apples to apples.
No, I guess I was just trying to analogize where we have county supervisors sit on certain boards or commissions. They haven't been necessarily in leadership, but nonetheless, I think I really do want to thank both the Vice Chair and Commissioner Hurst for agreeing to serve. I think we've been looking at how can philanthropy, because I know the discussion was, and I think it was even Commissioner Spitzer who might have brought it up, when this commission was first, I guess, founded, there was an interest in getting the rest of the county to help with funding opportunities, with support, with financial help, and the philanthropy community was one of the biggest priorities to make sure that they all have a place where they can support our efforts in government to try to address this. So to the extent that Commissioner Hurst is our philanthropic appointee, I think that'll bring us almost back to maybe some of the origins of this commission to say how can we bring the private sector in to help us solve this problem as well. It isn't a problem that can be solved, in my opinion, solely by government. So to the extent that we will have a nice blend here, I certainly appreciate the vote that I'm wanting to accept. So seeing no other nominations from the floor, I will ask all those in favor.
Aye.
All those opposed, motion carries. We will now move on to the next item. Madam Clerk, please do the next item.
Item 6 is to approve the 2025 Commission to Address Homelessness Annual Report for submission to the Board of Supervisors. We have no request from the public to speak on this item.
Great, and I will go ahead and ask for entertain a motion.
Wait. Spitzer.
Motion by Commissioner Spitzer, is there a second? Second by Commissioner Rosales. All those in favor?
Aye.
All those opposed, motion carries. And Madam Clerk, read the next item, please.
Item 7 is to approve the revised Commission to Address Homelessness 2026 meeting schedule calendar to amend the December meeting date from December 16th to December 9th, 2026. We have no request from the public to speak on this item.
Thank you, Doug. I'll go ahead and
Yeah, so this is just a real clerical adjustment. The calendar that you all approved at our last meeting for the 2026 slate, we realized that there was some conflicts in the December meeting, the December 16th meeting, so we're seeking approval to move it forward 1 week to December 9th.
Any questions or comments from the commission members? Seeing none, I'll entertain a motion. Okay, we have a motion by Vice Chair Cunningham, second by Commissioner Wynn. All those in favor? All those opposed, motion carries. Madam Clerk, the final item.
And the last item is to approve the Commission to Address Homelessness minutes from the December 11th, 2025 regular meeting. And we have no request from the public to speak on this item.
Thank you. And just for clerical purposes, I know that the agenda says December 11th, 2026. So with that revision, any questions or comments on this item? Seeing none, I'll entertain a motion.
I'll second.
We have a motion by Commissioner Shinagawa, a second by Vice Chair Cunningham. All those in favor?
Aye.
All those opposed, motion carries. I think that is it. Yes.
Can I say, before we come to an end, I just want to point out and thank the chairman.
It's 2:33, by the way. Let's make sure we.
Oh, good. I've got 27 minutes to opine here. But I did want to thank you, Mr. Chair. It's been 2 years that you've sat in this role, and the commission looks, I think, significantly different now than it did 2 years ago. And a few of the things that I really appreciate about the work that I think is really important, not about just about the work that this commission's done, and you see it in the annual report, but it's really been led by you. And I appreciate that, in terms of membership, as we've talked about membership, and it was mentioned by Commissioner Spitz, there's a couple of things that, we say as the office and what we've codified in our bylaws, and I think that you've been a really great example of that, is bringing ideas into the commission and bringing work into the commission for discussion. And being willing to be an ambassador and take, the work that's done here and put it into practice out in your sector. We've seen that through the, homelessness prevention and stabilization program, the WARM program, tiny homes. And then, you know, it's been 2 years of you sort of leading our efforts and allowing and driving that leadership to change the bylaws to make sure that this is a more active commission. So I just wanted to make sure we give a thank you to your leadership. And we're excited to have Commissioner Cunningham and Hurst in the coming year. But thank you very much.
Thanks for those kind words. I should say thank you to the staff. All of you really helped make sure that this commission functions in a way that's, you know, addressing issues. And I think that goes to all of us. And, you know, so I will take a collective, you know, thank you for those, for all the work that we've done, that we will do. And Commissioner, new Chair Cunningham, you know, I set the bar very low for you. You know, now and then, but thank you, everybody. This concludes our meeting for today. I guess our next meeting will be on April 15th, 2026.